Hey guys, I wanted to talk to you about Elevated PSA. What is PSA? PSA stands for Prostate-Specific Antigen, and it's an enzyme that is released by your prostate and your prostate alone into the bloodstream. When we draw your blood work, we look at that value, and if it's above a certain value, usually 4, it's considered elevated. What are the reasons why you can have an elevated PSA? It could be just due to a natural enlargement of your prostate itself, which happens to us men as we age. It could be due to an infection. It could be due to trauma. It could be due to testosterone replacement therapy because that builds up the prostate tissue, or it could be due to prostate cancer. The two main reasons why we have an elevated PSA is because of an enlarging prostate or because of prostate cancer. And the only way to tell the difference between those two is to do a prostate biopsy. I recommend a prostate biopsy today, and I'll explain to you why. First, I want to start off with the pros of the prostate biopsy, then we'll talk about cons and then a few takeaways. Starting with the pros is the fact that it gives us a lot of really good information. First off, we find that you don't have prostate cancer. Not only is that great you don't have prostate cancer, but we know that your PSA is just naturally elevated. It's higher than others, but it's normal for you. I have plenty of patients that live in an elevated PSA zone and we know that they don't have prostate cancer. The second thing we find is that prostate cancer in its infancy stages, and we don't need to treat it. Prostate cancer in general is something that men die with, not because of. So for instance, you'll get to 100 years old, natural causes will get you before the prostate cancer would. The third thing we find is a prostate cancer that is aggressive enough that it may prevent you from getting to 100 years old because it can grow and then become something that gets you. If there is a good caveat to all this is the fact that if you do catch that prostate cancer that is aggressive enough, then you treat it, then you tend to go back into the category of you die with prostate cancer and not because of it. So those are the benefits. Now we talk about the risk. The risks are much less than the benefits. So anytime the benefit outweighs the risk, that's when we can recommend something for you. The risks are very minimal. The prostate biopsy used to hurt. It no longer hurts anymore because we sedate you. Secondly, there's a very small chance for infection. We have to cross tissue barriers in order to get the prostate tissue samples that can seed infection. There's a low chance for infection. We give you antibiotics before and afterward in order to decrease that chance to much smaller. And the other thing that can happen is some blood in the stool, urine, or semen. This may or may not even happen, but even if it does, it's harmless and always goes away on its own. So now we've talked about the benefits, we've talked about the risk, now we'll talk about a few logistical things. First off, it's done as an outpatient setting. We do it in our surgery center that's connected to our clinic there. We bring you to the procedure area and then we sedate you, and then I do the biopsy. It takes about 2 minutes to do, and then we wake you up and then you go back to all your normal activities afterward. The only thing you cannot do is drive afterward, but other than that, you can go back to all normal activities. There are some other logistical things, but we will walk you through each step of the way. That includes no eating past midnight. Make sure you take those antibiotics. They will also give you an enema, but this is something that is very, very safe, something that's very common. This is by far the most common thing that we do, and we'll make sure to get you taken care of.